Breastfeeding is one of the most natural things, but that doesn't mean it comes naturally for both mothers and their babies. It takes time and practice, and every mother's breastfeeding story is different. But there is one consistent thread throughout each of these stories. They are giving their babies the healthiest start to life. Breast milk gives babies the nutrition, energy, and immunity they need to grow up strong, healthy, and smart. From the moment your baby is born, there are a number of things you can do to improve your chances for breastfeeding success. Here are some quick lists of expert tips to help new parents breastfeed their little one. 1. Create a nursing station. Before the baby arrives, create a nursing station. An area with a comfortable chair, a breastfeeding pillow, and a side table for snacks, water, nursing pads, burp cloths, your phone, and a good book. You'll spend a lot of time there. 2. Stay together after the birth. Keeping your baby with you after the birth will promote a feeling of closeness and a strong hormonal response that is linked with breastfeeding success. In many cases, it is even possible to have your baby with you immediately after a cesarean birth. 3. Get your position and attachment right. The first few days after the birth offer the best opportunity for you and your baby to learn to breastfeed. Your breasts are still soft for a few days after the birth. Then, as breast milk changes from highly nutritious colostrum to mature milk, your breasts can become quite full and firm. Try and use the first few days to get your position and attachment right. This may help to avoid potential problems down the track. You can hold your baby in a number of ways. Some of the most common positions are: put your baby's head in the crook of your arm. Support your baby's back and bottom with your forearm. Your baby should be lying facing you. Your breast should be right in front of your baby's face. Sideline. While lying down, place your baby alongside you. Your baby should be facing you. Pull your baby close to you so they can latch on. You can use a pillow to prop up if needed. This position is helpful if you had a cesarean section, C-section. You don't want to fall asleep while nursing in this or any other position. Co-sleeping can be dangerous for your baby. It increases the risk of sudden infant death syndrome, SIDS. Tuck your baby under your arm along your side. Their head should be resting in your hand. Support your baby's body with your forearm. Your baby should be facing you. This position is helpful if you had a C-section. It also can help if your breasts are large, your baby is small, or you have multiple babies. Cross cradle. Hold your baby with the opposite arm of the breast you're using. Support your baby's head and bottom with the palm of your hand and forearm. Your baby should still be lying facing you. This position can help premature babies or babies who have a weak suck. It provides added head support. Support your baby's feet. Babies always seem to nurse better when their feet are touching something, like your leg, the arm of the chair, or a pillow tucked next to you. It makes them feel more secure. 4. Be patient. Breastfeeding is a skill that both you and your baby are learning, and for some mothers and babies, it is harder than it is for others. Like anything new, it takes time and patience. Relaxation is important for both you and your baby. If you find you are getting frustrated or angry at yourself while you're trying to breastfeed, stop and try again in a little while. If your baby is distressed, and if it is possible, ask someone to keep them distracted until you are ready to try again. You could also express this feed and try feeding from the breast for the next feed. 5. Feed on demand or according to need. While you are establishing your breastfeeding, your baby will feed between 7 and 12 times in 24 hours. This will settle over time. Frequent and effective feeding will help you to make enough milk for your baby. 6. Keep baby in the room with you. There are many benefits to having your baby in the room with you in the hospital and at home, including that it reduces the risk of sudden infant death. It also promotes breastfeeding. Having your baby in the same room as you will help you to recognize when your baby is hungry, tired, or in need of a cuddle. It will make it easier for you to know when your baby is ready to feed. It is important to provide a safe sleep environment for your baby night and day. 7. Avoid teats, dummies, and complementary feeds. Because your new baby is still learning to breastfeed, they can become confused if they are offered a teat or dummy. If your baby has fluids other than breast milk, they will breastfeed less, and your breast milk supply will decrease. Frequent, unrestricted suckling at the breast will satisfy your baby and ensure that your milk supply continues to meet your baby's needs. 8. Wait with introducing a pacifier. Giving your baby a pacifier can help soothe her between feeds. However, offering it in those first few weeks can have a negative effect on your milk supply and discourage your baby from wanting to nurse. Experts recommend waiting until your baby has gotten used to breastfeeding before offering a pacifier. Of course, you may use a pacifier sparingly to comfort your baby earlier than that, like when she's getting a vaccination. But you could also offer her your clean pinky finger to suckle on for comfort during these short periods. 9. Store breast milk safely and easily. Breast milk freezer bags or nursing bags are best for storage in the freezer. Laying them flat in the freezer will save space when frozen. You can then place them upright. And a huge advantage of this is that the breast milk defrosts faster. Also make sure that all the air is out of the bag. While freezer bags are convenient and space-saving, they have the opportunity to leak. To avoid damage, place your bags in firm plastic containers or double bag it if it's a thinner storage bag. When storing milk, it's important to label each container with a smudge-proof marker with the date expressed and the amount of milk in each container. Use the oldest milk first to keep your supplies fresh and avoid expired or sour milk. If you're delivering stored milk to childcare, you should also label the container with your child's name to avoid mix-ups. 10. Breast milk only for the first 6 months. When babies are exclusively breastfed, they need no other food or drink until at least 6 months of age. You can be confident that your baby is receiving enough breast milk in the early weeks if they have 6 or more heavy wet nappies and at least 1 bowel motion a day. It's also a good sign if your baby settles after most feeds. 11. Stay hydrated and drink plenty of water. Your body is losing a lot of liquids while breastfeeding. That's why it's important to increase the amount of water you are drinking in order to stay properly hydrated. This will also help your body to produce milk. It's recommended to drink 8-10 glasses of water a day. While water is the best for your body, you can also drink milk and fresh fruit juices. 12. Use both of your breasts each time. A baby needs 8 to 12 feeds in 24 hours for the first 4 to 6 weeks of life. It is helpful to use both breasts during each feeding session so baby can gain weight and you can build your milk supply. 13. Keep a hair tie on your wrist. It's a good idea to start your breastfeeding session on the breast that you ended on last. A simple way to remember which side to start on is to keep a hair tie on your wrist and switch it to the side you need to nurse from first. 14. Use a Breastfeeding Tracker App. If you're struggling to keep track of things, try a Breastfeeding Tracker App. These apps can track the start times of each feeding, which breast the baby was on, and how long the baby was feeding for each nursing session. 15. Prepare for a lot of leaking. Invest in breast pads. Stash them in the bathroom, your purse, your car, wherever you can. Leaking should subside around 4 months, but it's always a good idea to keep cleansing wipes and breast pads on hand to clean up any messes. So that was all for today's video. We hope you liked the video and our tips will help you in your parenting. More videos like this, do subscribe to our channel and please leave a like to show us that our tips help you. See you next time.